Okay, so just getting started with that. As I mentioned, this is the advising session for the BSN students that have been admitted to start this fall quarter. My name is Rhonda Mitchell, so some of you that have been to some of the events may recognize me or recognize my name, and hopefully from the email that I sent out. So again, my name is Rhonda Mitchell. I am the transfer advisor for the College of Nursing, and I advise the students that are in the BSN program, but also the transfer students coming into our diagnostic ultrasound program. And so just to kind of get started, I'd like to sort of open the session with a little bit of a joke. So the joke is, how long does it take a nurse to change a light bulb? Anybody heard this one? Anybody want to try to guess? Nope. Okay, so it takes about 15 seconds tops to change a light bulb, and then 20 minutes to document it, which is the how, the when, the where, the why, and what serial number it had. And so for those of you just getting started, if you've not worked in the healthcare field or been around that type of environment, that joke will make a lot more sense as you finish your first quarter, which is with your health assessment class. And you'll know why that's such a funny joke for nurses. Okay, we'll kind of move into getting the PowerPoint going. So I'm going to share screen, and then we will jump right into the information. Okay, so hopefully everybody can see that title screen there on their page. Okay. All right, so a couple of other introductions, since I introduced myself, and hopefully you've seen this from some of the other events and things that you've been to around your time in going through the application process and information sessions. But the dean for the College of Nursing is Butch DeCastro. He just started with us last year, so he's been in the position for a year. Has been doing a lot of great things, kind of looking at a lot of different things, and doing some really creative changes within the College of Nursing that we're pretty excited about. Curriculum-wise, there's not much that's going to be changing, so for classes and things like that, but it's some more of the behind-the-scenes things that we're looking at. But we're definitely excited to have him in that leadership position. Again, this slide should look pretty familiar from some other events. This is the undergraduate nursing team. So a lot of the folks on here are advisors. So my counterparts are Carlene Ratcliffe, Robel Kamat, Tammy Soderberg is our onboarding clinical onboarding coordinator. Grace Laguna is one of the academic advisors. Maya Mosteler is our program coordinator. And then you won't work with these folks too much because they're in the diagnostic ultrasound program, but Maret Aziz and Christina Popchoy. And then Jamie Navetta is our current interim associate dean. And we will have a new interim associate dean that will be starting this fall. Okay, so we'll jump right into the important stuff, and that is the information to prepare you for starting your fall quarter and then prepping you for registration. So a little bit about our advising model. So the Seattle University College of Nursing has professional advisors and faculty advisors. And the difference between the two is I am a professional advisor. I know higher education policies, processes, procedures, programs, how to get ready for registration, how to navigate challenges with students, all that stuff. Faculty advisors do all of that same stuff, but they're faculty within the College of Nursing. And so they are working in the field of nurse as a nurse. They have gone through a nursing program, and they have worked as a nurse if they aren't still currently working as a nurse. So I have never taken a nursing class, and I have never worked in the healthcare field or worked as a nurse. So that's why I'm considered a professional advisor. And you'll have me as your advisor for this current year, your first year, which is your junior year. At the end of that junior year, as you start your senior year, you'll be transitioned over to a faculty advisor. And we do a lot of the same things, except that I do a lot more of the onboarding, transition, making sure you're familiar with how to register and use the systems. And then the faculty advisors are going to do a little more of that mentor role, preparing for the NCLEX exam, sort of more career discernment, what type of nursing you want to go into, what type of research you might be interested in, that type of thing. Regardless of what advisor you're working with at any point in time in your program, we do require students to meet with their advisor at least one time every quarter, and that's usually our registration planning sessions. And you'll get an email from me when to start registering and signing up for those sessions. But just know that that is a requirement by the College of Nursing, and so you will be required to meet with your advisor at least that one time per quarter. Okay, so what will we be talking about in those advising sessions? So those advising sessions are where we're going to talk about educational planning, which is like mapping out your program of study, your courses, making sure everything's going smoothly with registration, addressing any questions you might have. We'll talk a little bit about career discernment, but again, that's probably going to be covered more by your faculty advisor than by me. If you're interested in doing study abroad, there are some study abroad opportunities that we can talk about. And again, for the transfer students, that'll be a little bit limited, but it is something that we can talk about if you are interested. Navigating changes and challenges that might come up for you either academically or personally throughout your time in the program. Whether it's me as your advisor or your faculty advisor, we're always here to help you navigate those changes. We are here to help you also navigate and connect to resources. Some of those resources might be helpful based on some of the changes or challenges that might be coming up for you as you go through the program. And so those might be resources like tutoring, or maybe it's non-tuition scholarship or emergency funding, or maybe it's some resources in the library, or maybe it's community resources. So there's a ton of resources available through the university that we will help guide you to. Some of the advisee side of that is we want to make sure that you know how important it is to check your SU email daily. You will miss things and important things that have really important deadlines with the College of Nursing for clinical requirements, clinical scheduling, some of those types of things. So make sure that you start setting up a way to remember to check that SU email at least daily as you're going through the program. Because like I said, there's a lot of stuff that you can miss. Also, just reviewing all advising information that I send out prior to our advising appointments. There's going to be a lot of information that you get about the classes before we meet, and then we can address any questions that you have and do kind of a check-in when we meet for those advising meetings. Of course, you're going to meet regularly with your advisor, as we already mentioned. Knowing your degree requirements, that's something that we'll go over as you go through the program. But definitely something that you're going to know how to track as you go through the program, and be able to track that through our degree audit system. And we'll talk about that a little bit later. And then, of course, knowing the rules, policies, procedures, and deadlines, and then reviewing the BSN handbook. The BSN handbook is currently under revision. So the version that you see on our current website will look a little bit different as we get into the fall quarter. But definitely know if you have any questions about policies or processes, you can certainly start with reaching out to me, and then I will be able to help guide you through some of those as those come up. But main thing we want you to know is we are here to support you as you go through your journey with Seattle University to becoming a nurse. Okay, so what are some of the academic requirements that we want you to be aware of? The main thing that we want you to be aware of is that we track 2 levels of GPA as you go through the program. Those are going to be your cumulative GPA, which has to be at a 2.75 or higher. That means you have to have about an average of a B- in all of your classes to maintain that 2.75 cumulative GPA. That cumulative GPA is going to be made up of your university core or U-core classes and your nursing major classes. And we'll talk about what those U-core classes are here in just a second. The other GPA that we track is your nursing major GPA, and that currently has to be maintained at a 3.0 or higher. Now that means you have to have a B average or higher in all of your classes in a quarter and over the program to be able to maintain that 3.0. So a student taking nursing classes can get a C in a nursing class and pass the class and still continue on and progress through the program. However, if you get a C, for example, in your first quarter for pathophysiology, and then you get Bs in your university core or U-core class and your health assessment class, you could potentially go on warning because your major GPA would drop below that 3.0. So even though you might pass the classes, you still have to maintain that major GPA minimum to stay in good standing throughout the program. Now, believe me when I say the faculty and I work very closely to stay in touch with you as students, and we work very closely to connect with each other to support students who may be struggling in a class. So if you are having a challenge in a class, please reach out to me early so that we can talk about strategies and things to sort of help support you through the class, because we want to make sure that you are staying in good standing as you go throughout the program. Okay, so what are those U-Core classes? So U-Core classes are classes that are going to assist you in becoming a stronger interdisciplinary thinker. They're going to help you develop critical thinking skills for your personal and professional growth. They're also going to give you a holistic and global perspective that can be helpful in working with other people, particularly patients and other folks on your teams as you go out into the professional world. This is particularly important because of the mission within the College of Nursing. The university core classes also help round out your Jesuit university education because we are a Jesuit university. So here, this is a quote from one of our past directors for the U-Core office, and that is the University Core helps students grow as scholars, citizens, and as reflective, engaged, whole persons ready to make a difference in the world, which completely aligns with the College of Nursing mission as well. Okay, so what are those U-Core requirements? So U-Core classes are graduation requirements, and they are structured in modules. We have module 1s, which are 1,000 level classes, module 2s, which are the 2,000 level classes, and the module 3s, which are the 3,000 level classes. Now, module 1 or 1,000 level classes are typically satisfied with transfer credits. Most students in the cohort will have those all satisfied either through transfer credits or through the program, and you'll see those as waived in your program evaluation if you've already looked in that program evaluation. There are some of you who may have additional U-Core 1,000 level classes that you need that maybe you didn't have, or maybe you didn't complete a DTA degree. And if that is showing up in your program evaluation, I assume that the admissions counselors are already working with you on what steps you need to take with that. But if you have any questions with that, you can certainly reach out and let me know as well. Those module 2 or 2,000 level classes are required by all students in the cohort. There are 3 of the 2,000 level, and those have to be taken at SU. And then there's 1 3,000 level class. And again, that one also has to be taken at SU. Okay, so those specific 2,000 level classes, they are going to be U-Core 2100 or Theological Explorations. And there are lots of different topics to choose from. So if you've been in the class search already, you've maybe noticed a lot of different topics for the classes. The U-Core 2500, which is the Philosophy of the Human Person, which is our Intro to Philosophy class, it's one class, it's one topic for all sections. It's an Intro to Philosophy class. It is the prerequisite for the U-Core 2920 that you will also take as that 2,000 level requirement. If you have completed a bachelor's degree, the U-Core 2500 class is waived. If you have not completed a bachelor's degree, the U-Core 2500 class is a required class that you have to take. That U-Core 2920, which is the last of those module 2 classes, is ethical reasoning in healthcare. And again, it's one topic for all sections. They're all ethical reasoning in healthcare, and there's really no differences between the classes and the topics covered. The 3,000 level class, there is only one 3,000 level class that is required for most of the students in the cohort. And that can come from any one of the 3 categories listed here. So it might be a U-Core 3400, which is our humanities and global challenges. It might come from U-Core 3600, which is the social sciences and global challenges. Or it might come from the U-Core 3800, which is the natural sciences and global challenges. And again, if you have a completed bachelor's degree, this particular 3,000 level requirement is also waived, just like the U-Core 2500. All right, there are 7 quarters to complete as you go through the program. and they look a little like this. So again, this should look a little bit familiar as well from some of the other sessions that you've attended and for sure from the website. But the main thing to go over here is the amount of time, and then we're going to kind of go over each of the quarters and talk a little bit about the classes. Okay, so the quarters that you have that you're going to be going through and completing as part of the 2-year program are listed here. There are 7 quarters. So you're going to start in fall of 2024, and you're going to graduate in August or at the end of summer of 2026. Okay, and so you can see those here. You've got your junior year, fall, winter, and spring, your senior year, fall, winter, spring, and then your last 3 classes for that summer term. And then you can see your Module 2 requirements listed here, and then your Module 3 requirements listed here. Okay, so for this fall quarter, you are going to take a UCOR class. It can be a UCOR 2100, a 2500, could be a 3000 level class, right? So we'll kind of talk about that here in a little bit as well. But you're also going to take a health assessment and interventions class. Now that class is where you're going to actually learn the skills that you're going to need to develop more as you go into your clinical classes. But this is going to prepare you for those clinical settings. You're going to learn how to do injections. You're going to learn how to do blood pressures. You're going to learn how to do head to toes, how to write patient reports, right? So you're going to learn how to do all of those skills that you're going to encounter in those clinical settings. And this is going to be the foundations class for that. You're also going to have pathophysiology, and pathophysiology is like the next step after your anatomy and physiology 1 and 2. So in those 2 classes, you learned all about the body and the body systems. And in pathophysiology, you're going to learn about all of the diseases and disorders or pathologies that can happen in those body systems, and also what they're going to look like and how you'll encounter those in the clinical settings. Your second quarter, you're going to have your Intro to Pharmacology, which is probably one of the hardest classes that you'll have. But we have a lot of resources to help you navigate this class as you go through the program. You'll also have healthcare in the 21st century, and then promoting health of older adults theory and promoting health of older adults clinical. So your winter quarter is when you're going to start your first clinical class. And when we meet to do that required advising, I'm going to give you a lot more information about the specifics on how to be prepared and what to anticipate from that theory in your clinical class. In spring, so the spring of your junior year, you're going to have another UCOR class. And this is where the cohort is going to divide in half. Half of you are going to do mental health theory and clinical, and half of you are going to do reproductive health theory and clinical. And so again, when we get to the advising for spring quarter, I'm going to give you a lot of information about how to decide which one you're going to take in that spring quarter, and then what that's going to look like as you get ready to prepare for each of those theory and clinical classes. And then you're going to also have your nursing research methods class. And again, we'll talk about the specifics of that when we get to those advising meetings. Okay, then in fall of your senior year, you're going to have promoting health of populations and communities theory. It's a lecture class that's going to prepare you for your year-long population health internship that you're going to have in that senior year. In the fall quarter, again, this is where the cohort is still divided in half. You're going to have mental health theory and clinical, and reproductive health theory and clinical. So for the students that took mental health theory and clinical in the spring, they're going to take reproductive health clinical and theory in the fall, and vice versa. So again, that's the specifics of each of those classes will be things that we'll cover in those advising sessions to make sure that you're prepared and know what to anticipate for those classes. All right, then in the winter, you're going to have another UCOR class to take, the second quarter for your internship class. And then this is where you're going to start the next track for your specialties for clinical. So here, the cohort again is going to be divided in half between promoting health of children and families, theory and clinical, and promoting health of adults, theory and clinical as well. And again, more specifics will come to prepare you for those classes as well when we get to those advising meetings. Then in the spring, you're going to have your last U-Core to take, the third quarter for your population health internship, and then the other specialty, whichever one you did not do in the winter, you will do in the spring between promoting health of children and families theory and clinical and promoting health of adults theory and clinical. Then in your final quarter, your last 3 classes are going to be what they are listed here, your senior synthesis, transition to professional practice, and your senior practicum. Now, these 3 classes are going to work a little differently than the previous classes, and we'll talk about what those will look like when we talk about preparing for your senior year. But the senior practicum is going to be your final clinical, and that's why it is a 6-credit class. This is a summer quarter. It's an 8-week quarter. So we want to make sure that students are aware and remember, try not to plan much in that summer of 2026 because you are going to be a very, very busy person with doing your clinicals in these 2 classes to finish up your program. All right, so that is, again, back to what the 7 quarters look like as a full 1-page plan. And again, this is something that we'll go through individually in those advising sessions, and we'll talk about more specifics at those times to prepare you for those quarters. Okay, so the program evaluation. So I kind of mentioned, and I hope everybody's already been able to find that through the My Seattle U orientation modules and then through your My Seattle U portal. The program evaluation is Seattle University's degree audit program. It's where we track what credits have been transferred in for Module 1 requirements and your prerequisites. So this is where you're going to be able to track anything that you're missing, and I will be helping you manage and navigate that. But this is something that I recommend that you get used to using and going into to track your progress each quarter, and specifically as you go through that senior year. It is going to track what courses you need to complete your program, but I also want you to know that the nursing classes that are the way they're listed in the program evaluation are not the correct sequence. So that I will give you a tool that as you get closer to starting your fall quarter, that I'll send out. Everybody will have an individual advising plan that we'll talk about and update as we meet for those individual meetings. But that will be the one that you'll follow to know what classes you're going to take in what quarters, because the nursing classes are not listed in the correct order based on when you'll take them. Also, your program evaluation is where you're going to be able to keep track of your cumulative and major GPA so that you can know where you are and if you're maintaining those minimum numbers that we talked about earlier in the presentation. Okay, so if you haven't found a program evaluation, this is just a screenshot of how to find it. You'll log into your My Seattle U portal, and then when you come up, it should come up with a screen that looks a little bit like this, and then you're going to click on the Student Planning button, and when you do, it should take you to a screen that looks similar to this, and your program evaluation will be the button on the left where it says Go to My Program Evaluation, and that will take you to the degree audit system so that you can see those requirements. See if you've got any Module 1 requirements that are still needed, and then see where you are with the prerequisites being admitted and uploaded into your program. Okay, so now we're going to talk a little bit about the fall schedule. As we talked about, you're going to be taking 3 classes, your pathophysiology, which is Nurse 3205, and it's going to meet on Mondays, Wednesdays, and Fridays. Now, when you go into the schedule, if you've already been in there, you may have noticed that there are 3 sections that are showing. Sections 1 and sections 2 are for nursing students only. Section 3 is only available for the diagnostic ultrasound students that are also taking pathophysiology this fall, but we don't have you all integrated in the pathophysiology class. So nursing students will only be able to take Section 1 and Section 2. You are not going to be allowed to take Section 3. Then you're going to take the Nurse 3405, which is the Health Assessment and Interventions class, and it's also going to meet on Mondays, Wednesdays, and Fridays. Now, there are lots of sections available, but they're broken into 2 time categories. So the 2 time categories are 8 a.m. to 11:30 a.m., and then 1 p.m. to 4:30 p.m. Now, the 8 to 11:30 sections 1 through 4 are going to be the ones that will match and go with Section 1 of pathophysiology. And then sections 5 through 8 for the afternoon are going to go with section 2 for pathophysiology. So as you're going in to plan your sections and register for the health assessment and interventions class, it does not matter which one of the sections you register for. If you are doing the afternoon health assessment, you can register for section 5, 6, 7, or 8. And if you're doing the morning, you can register for section 1, 2, 3, or 4. And I have a visual that we'll go over here in just in the next slide to kind of help you see what the schedule is going to look like and just kind of looking at it over a week. The other class that you'll take is a UCOR class. So most folks in the cohort are going to be able to take UCOR 2100, UCOR 2500, or the 3400, 3600, or 3800. Those of you who are post-bac students that already have a bachelor's degree, if you have questions about the UCOR showing for you and some of your options for that, those are things that we can do in those one-on-one meetings. But what I'd like for you to know is if you go in, you might see some asynchronous UCOR options. Most of those are probably full because the continuing students registered for classes last week. So if you're looking at those and wondering how you can get into those, they'll say that they have a wait list, but it's not really a wait list. There's a form that you would have to fill out to be submitted to the university core office to be reviewed as to determine whether your situation might be a situation where they would consider having you be able to be placed in one of those asynchronous sections. So I can tell you right now, make sure that you are planning to be attending an in-person UCOR class, particularly for this fall quarter. I have seen some students get a spot in those asynchronous sections, but it usually comes if they're watching the classes over the summer. And if they happen to see a spot open up, then you can certainly register. But 99% of you are going to have to do an in-person UCOR because we have very few asynchronous sections or those online sections. Those UCOR classes are going to meet on Mondays, Wednesdays, and Fridays, or Tuesdays and Thursdays. So if you're looking and you want all of your classes to be on Monday, Wednesday, Friday with your 2 nursing classes, and you're looking at the sections for UCORs and there's none that are available, you would have to look at those Tuesday, Thursday options. And again, that might mean that you're on campus 5 days a week to manage and navigate that UCOR if you do a Tuesday, Thursday UCOR. So again, I'll be available to answer questions for those as that comes up after registration and over the summer as you have questions for those UCOR classes. Okay, so the cohort is going to divide between the sections for pathophysiology and the 2 options for health assessment. So as I said, so the cohort's going to divide in half. Because there are 2 time sections for pathophysiology, sections 1 and section 2, we're going to look at what a visual of what a week schedule would look like. And then we'll talk about what happens if the sections you have planned are full when you go in to register. Okay, so for option 1, if you're wanting to take health assessment in the morning and then pathophysiology in the afternoon, this is what a sample week schedule would look like. So you have your health assessment in the morning, you'll have a short break, you'll go right into your pathophysiology class, and then you have some space to do a UCOR, if you can find one that works with your schedule, on Monday, Wednesday, Friday. Again, if the Monday, Wednesday, Friday UCORs are full, you would have to look at a Tuesday, Thursday UCOR option. Okay. Option 2 is if you're doing pathophysiology in the morning, and you can see that's a very early morning class. So for those of you who are not early morning folks, that first option might be a better option for pathophysiology. But there is a good long break between pathophysiology in the morning and then your health assessment in the afternoon so that you could fit a UCOR in between those 2 classes. And there are some Monday, Wednesday, Friday options. Or if those are full, again, you might have to look at a Tuesday, Thursday option. Okay, so to kind of compare the 2 side by side, this is what they'll look like. And I know that option 1 is usually the preferred because you can actually end your classes a little sooner, particularly if you do a Tuesday, Thursday UCOR, then you're done with your classes by 1:30. So this one is by and large the most popular. However, I just want to make sure that you all know that as you register for your classes, If that option, for those options for the pathophysiology are full, you are not able to be added to that class if you have to register for the section 2. Okay, so if section 1 is full by the time you go in to register, you will have to register for section 2. And once those sections are full, we are not able to move students to that full section. That said, you can watch that section to see if spots open up, because sometimes that will happen over the summer. So if a spot does open up and you happen to see that, you can certainly switch your schedule and change that on your own through the portal. Okay, so if you haven't been into your plan and schedule yet, or if you have, it may look a little bit different. There is a tab. You won't have all of these. This is my advisor view, but for your student view, you're going to have 2 tabs. One is a course plan, which should be familiar to you. If you've been in there, it's going to be where your plan and schedule are. But the other one is a timeline, and the timeline is where it's going to list all of your classes throughout the program. And those are showing up because we have uploaded a curriculum template. And it is just that, it is a template for the nursing program where it's very structured. You have your UCOR, you have pathophysiology and health assessment. Those are not going to move. Here, where you have your healthcare in the 21st century, your older adult theory, older adult clinical and pharmacology, those are not going to move. But here in the spring and the fall, where I said, in the spring, half of you will take mental health, half of you will take reproductive health. This is where these might move around, and you can drag and drop. So you can literally click on this and drag and drop classes so that you don't have to go back do the class search to add classes to your plan. Whatever shows up in the timeline view is what you're going to see in your student plan. And we'll see what that looks like in just a minute for those of you that haven't been into that system yet. But just know there is this timeline view, and I will go around and move things around in this if I see something that's gotten moved around or moved into the wrong quarter. So I'm also sort of watching that as you go through the program as well. But certainly know that you can move things and edit things in this timeline view. But it does change what shows in your schedule as well for any planned classes, but not for classes that are registered. Okay, so how do you get to your schedule then to see what classes you need to register for and get all set for registration? So again, when you log into your My Seattle U portal, it's going to come up with that student planning and all those buttons. You'll click on the student planning, and it'll take you to this screen, but instead this time you'll click on the Go to Plan and Schedule. Now, this is just one of the ways to get to these resources for the program evaluation and the plan and schedule. There's also a lot of navigation that you have over here on the gray bar. As an advisor, I don't have access to see those. So I would say definitely make sure that you explore this on the left side, because sometimes those are some quick links to get to the same places that I'm showing you how to get to here. So from here, you'll click the Go to Plan and Schedule. And you should see a screen that looks similar to this. It'll have like an image and some personal information above this. It'll have class search up in the top right corner. It'll have a notification bar across the top. But what I'm mostly wanting you to pay attention to and focus on is the course plan, the timeline tab, and then your quarter that's listed. And then below that, you'll see the calendar, which shows the classes that are in that timeline that have already been uploaded. And those are what are showing in your plan. So for all of you, you should see pathophysiology, health assessment and interventions, and probably UCOR 2100. If you are seeing an error message like this in this view from your plan, this means that you have a prerequisite that is still outstanding, and that will block you from being able to register for this class. It does not block you from planning what section you want to take, though. So you can still click on and follow all of the next steps, but just know it will prevent registration, and that's something that you'll reach out to me regarding if that's something that is still in place when you go to register on June 3rd. Okay, so how are you going to plan those sections from here? So under each class, you can see the View Other Sections link. So you'll click on that link, and it will then open up a little view of the sections available for that class. Now, for pathophysiology, there are only 3 sections, so you only have these ones that are visible. So please watch this section right here, because multiple pages can show up, which you'll see in just a second. But from this view, if you wanted to pick section 1 for pathophysiology and plan that class, you would click on this square. And when you click on that square, it will come up with a pop-up window that looks like this. And this view will show a lot of different prereqs that are required, and that's normal. It shows all prereqs required in this view, even if you have them completed. So this does not tell you if you have some of those prereqs outstanding. This just tells you there are prereqs for the class. But from this pop-up view, you would add section. So click on that button to add the section to your plan. Okay, so for your health assessment, you're going to do the same thing. Click on View Other Sections. Now, right now, you'll see that those are all showing as full, but it should let you plan the section, even though they're showing as full, and that just means we've got them closed off so that nobody can register for those sections just yet. That will be open and visible for you when registration opens. But you can see right here, there are 2 pages of sections to view. So as you're scrolling through, you're going to probably see the first 5 or 6 sections, but then to see the other sections for the afternoon session, you have to click on this right toggle arrow to see the second page of those sections. Okay, so just know the first few sections that you see for health assessment are not the only ones that there are available. Always make sure you look here to see how many pages of sections there are to view. Same for the UCORE classes. Once you click that View Other Sections to pick a section to plan, you can then see lots of options. So there's this online asynchronous that is already full. It says it has a wait list. So again, there is a process and a form that you have to fill out. It's not really a wait list that you can join from your student portal. But you can see here is a section that is available. It still has spots open. Here's a section that has spots open, and then you can see this section is full. But the main thing to point out here is UCORE classes have many sections, up to 16 sections for you to choose from. But you will only see all of those sections if you remember to toggle through all pages of the sections, because this first view only shows the first 6 sections. So to see all of your options, you have to make sure that you toggle through all the pages of sections to choose from to plan. Okay, so that's how you'll plan your sections in kind of doing some screenshots and walking you through the portal view. There are some students who like to have those step-by-step guides, and so I created that slide here. You don't have to take pictures of these slides or write notes or anything down, because I'll be sending out the slides to the cohort, so you'll have these to refer back to if you have any questions or need to kind of go back to anything. The main thing to cover from this slide, though, is once you add a section to your plan, that section is only planned. It is just what your preferred option is, so that you can see what your schedule will look like on that calendar view. Planned sections do not guarantee that there will be a spot in that section when you go to register. So say if registration opens on June 3rd and it opens in the morning, but you're not able to go in and register until the evening, any planned sections that you have, if you go to try to register and they're full, it's going to give you an error message, and then it's going to tell you to choose another section. So planned sections do not guarantee registration in that section. So again, be prepared to choose the other option for pathophysiology and health assessment if your planned section is full, because we are not able to make exceptions or exemptions and move students into a section that is already full. But again, as I mentioned, you can watch those sections over the summer, and as it gets closer to the fall quarter to see if any of those sections happen to open up, and then you can make those changes on your own. So now that we've got you kind of prepared for registration day, how are you going to register? So again, you're going to go into that schedule, that plan and schedule. And then this is just some small screenshots. So again, you'll be able to see the quarter. You'll see this is just a close-up of your list calendar. So you'll see that below. But right across from the fall quarter, on that side of the screen, right now it's probably a long white button, but it will turn blue and it will look just like this. And it will say accept terms and register now. So you will click on that blue button and it will register for all the planned sections that you have on the left, if there are spots available. If any of those sections are full, it will come up with a prompt and tell you this section is full, please choose another section. And then you can go back into that left side view and click on the view other sections and then choose another section from there. You don't have to go back and do a whole class search to pick other sections. Okay, so how are you going to know if you've actually registered? If you are looking at your planned section before registration and you have all your sections planned, on the calendar side, you'll see the boxes are yellow and it will have a little yellow mark over here that says planned sections. Once you are registered, everything will turn to this green check mark and it will say registered but not started. And that will be for each class. So you'll be able to scroll through each class and make sure that you got registered. You'll also see the boxes on the calendar will turn green. So that's also a visual cue that you've been registered for those classes. Okay, so what happens if you're looking at the UCOR 2100 classes and those sections are all full, or you want to look at other options for UCORs? You can certainly change that UCOR from the template, right? You can take that UCOR 2100 out and you can look at the other UCOR classes. For most of the cohort, those other options are going to be UCOR 2500, UCOR 3400, UCOR 3600, or UCOR 3800. And again, on the left-hand side of that screen, and this is, I'll show you a screenshot in just a second. So when you go into the class search and you type in UCOR 2500 on the top right corner in the portal, on the left-hand side, there's going to be a box that says term. You're going to select fall quarter to see the fall quarter classes only. Otherwise, it shows you all active quarters, which are currently the spring quarter. And you want to make sure that you are looking at fall quarter classes only. You're going to look at available sections. There's a link that you'll click on, and then you're going to add that section to the plan, and then go back to your plan and then register from there. So what that looks like when you do the class search is this. You'll type in UCOR 2500 in the search bar. It'll come up and show you the class. Here on the left-hand side are the terms. So you're going to want to select fall quarter 2024. And then once you do that, you then want to view available sections for 2500 because then you're seeing fall quarter sections only. And then you'll be able to go in and look at each of the sections. So then you can view all the different sections and see the ones that have spots and the ones that are full, the days and times. And this is where you'll add that section to your schedule or your plan. And then you'll have to go back to your plan and then register for that class from there. Okay, so there are going to be holds that will show up on your account throughout your time in the program. There is currently a hold on your account that would block you from being able to register. That hold is a new student hold. And for those of you attending this session today, or any of the scheduled sessions that are scheduled for next week and the week after, that hold will be removed prior to June 3rd for you to be able to register. So to get that hold removed, you just have to attend one of these advising sessions. If you don't attend an advising session, then that hold is not able to be removed until then. So the way that you can see holds and what they are, because you might have multiple holds that show up, above your plan and schedule, under your image and your personal information in your portal, you're going to see a notifications bar. It goes all the way across the screen, but you're going to see it'll say notifications and it'll have this circle. and it will say 0 if you have no holds that will block registration. If you do have holds, these are going to show up as 1 or 2, right? A lot of different holds will come up for you over the quarter, and we'll talk about those in those advising sessions if I happen to see those showing up, but you'll see them as well. Okay, so registration. Registration, as I mentioned, is going to open on June 3rd. Now, it's typically intended to open about 9 a.m. So I know a lot of students like to set an alarm or a reminder to make sure that they're ready to jump in and register right then. If you go in to try to register and registration is not open for you, it is okay. Just take a breather. Last year, it took about an hour for things in the system to get caught up and actually open registration. So again, it is intended to be open at around 9 a.m., but it might not be open until like 10 a.m. So I say if it's not available to register, just keep registering. Okay. If there's an issue that comes up with registration, I will email out to the cohort and let everybody know that there's an issue going on that's on our end. If you haven't received that, then it's just likely that registration just hasn't opened for transfer students yet. It's, like I said, 9 a.m., but it has a little bit of a wiggle room on that. Again, if you have issues with registration or you want to review how to go through in a live video, how to go through all of the stuff that was in this PowerPoint, you can just do a search for how to register for class videos, and it'll take you to the first link will be some short, like minute and a half videos that you can go and watch and do a review and see what that's going to look like live in your portal. You can also email me at my email, which all of you should have. Again, if you have those prereq errors that are showing up, you will not be able to register for pathophysiology through the portal, and you'll need to let me know so that I can manually register for you. And again, make sure that you get those transcripts with those final grades and classes into your admissions counselor as soon as you get those final grades so that they can get those updated and make sure that you're all set to register for pathophysiology. There are some cases where that's not just, the timing is just not going to work out. And if that is your situation, please reach out and let me know, and I'll have to do a manual registration. I don't know, and I cannot guarantee what section I'll be able to register you for, because I'm not sure when I will be able to get you registered, but it will be that day. All right, so fall quarter. So the first day of classes is going to be Wednesday, September 25th. There's going to be a whole bunch of different activities going on the week before, so definitely watch those orientation modules for that. There's a convening that will happen on Monday, the 23rd, and there'll be a presentation from myself and some of the other, some of the juniors that are in the program now. There'll kind of be a Q&A for really prepping to start that fall quarter. But all of your classes for fall are going to be in person, and throughout the program will be in person. We do not have online classes. That said, there may be some exceptions or exemptions to that. And those you will be notified as you go through those registration processes. And those will be things that I'll talk with you about if we get to that point, and some of those classes happen to be a virtual class. You should have all of your supplies and be in scrubs for the first day of health assessment. And I'll talk about scrubs and all of that here towards the end of this presentation. You will receive an email in early September from the health assessment faculty for additional steps to be prepared for the health assessment class, because there's a whole bunch of stuff that you're going to get that will prepare you for that class and being prepared to start that class. So another thing that you're going to get over the summer is a health packet and talking a little bit about clinicals. So the health packet are going to be the requirements that you need to be prepared to start those clinicals. Now you start your clinicals in the winter quarter, but the requirements for those have to be uploaded into a system, which we'll talk about in a minute. But those requirements have to be in that system, I believe it's in October. So you're going to get the health packet this summer so that you can get started on those requirements and get all of those things completed by that deadline. I also want everybody to know that while COVID vaccinations are no longer a requirement for Seattle University, they are a requirement by our clinical partners. There are no exemptions. for any COVID vaccination requirements for clinical sites. Okay, so if there is some concerns about that, just know that there are no exemptions. You have to have that COVID vaccination shot to be able to attend clinicals, and that's all clinical sites. There are some sites that now do require drug testing. That was not something that we had in previous years, but it is something that has changed just recently. So know that there are some sites that can and will require drug testing to be able to attend clinicals. All right, so how are you going to manage all of those requirements and making sure that everything is in place for those clinicals? That's where you're going to have your Castle Branch or online tracker. You will set up a Castle Branch account when you receive that health packet. Do not set one up before then to be prepared, because the health packet's going to have Seattle University specific portal information for Castle Branch to make sure you're connected to our portal and everything is in place for our folks to be able to help you manage those requirements. So what it does is it tracks your clinical onboarding requirements throughout the program and then notifies you when those items need to be renewed. And those are probably going to be things like your immunizations and vaccination requirements, certification requirements, and all those things that you need throughout the program to be able to be compliant for those clinical requirements. One of those is the CPR certification requirement, and I get a lot of questions about this. So the CPR certification is required as part of those health packet requirements, and it has to be done by that deadline in the health packet. The only CPR card that is accepted by our clinical agencies is the American Heart Association, or AHA, Basic Life Support for Healthcare Providers, or BLS. Equivalency cards are not accepted, unfortunately. So if you are thinking, well, I have Red Cross CPR certification, I'm good, you will have to redo it and do the American Heart Association Basic Life Support training for the CPR certification. Now, most of those classes can be done as an online class, and then you schedule a time to do an in-person skills test where you're working with the mannequins to show those skills for the CPR certification. So if you're not sure where to find those classes, just go to cpr.heart.org and you can look for any classes in a location where you currently are or where you're going to be over the summer. Like I said, you'll have, I believe it's until October to get those clinical requirements done. But I say definitely get that done as soon as you can to get that off of your plate. Okay, so a little bit about costs. Always get a lot of questions about costs. Tuition right now is $18,540 per quarter, and there are lots of other fees that get added to that. That is just our tuition. So if you want to kind of see, or if you're not sure what some of those fees are going to look like, you can go to our website and there's a tuition tab that you can go to, and there's a cost calculator. It estimates costs of textbooks and other different supplies. It shows you the fees, so you can kind of get an estimate of what the actual cost is going to be each quarter. For nursing students, there is a nursing fee that is assessed every quarter that you're taking nursing classes. And that is going to be $490 every quarter. So if you're looking at your billing statement as it gets closer to that time, that's what that fee is. It is simply because it's a nursing fee and it's specific to the College of Nursing. And it is to cover all of the supplies and other fees that you're going to run into that we cover as you go through the program. Some additional costs that you're going to have as you go through the program, but they're not limited to these, are scrubs, because you'll have to buy scrubs, some supplies, some textbooks. There's a background check, your Castle Branch tracker fee. And again, if you have access for your job already to Castle Branch, you will have to pay for access again because it's an SU specific portal for that Castle Branch tracker. And that cost is currently $87. You're going to have transportation to your clinical sites. You're going to have parking fees at the clinical sites, and those are going to vary from site to site. The NCLEX exam fee, so once you graduate and you take that NCLEX exam, that is currently costing about $200. And then other miscellaneous fees that can come up throughout the program. As you go in and you look at your textbooks requirements and you're getting those, I know some students like to get textbooks early. One of them that shows up is Safe Medicate. Please do not purchase safe Medicaid access through the bookstore early. You will get information from your health assessment instructor and the health assessment team for getting access to safe Medicaid, because you get that for 1 year, and we don't want it to start now. We want it to start in September. And so that's why you want to wait to do the safe Medicaid until you get that email from the health assessment folks. Okay, scholarships. A lot of questions about scholarships too, because I know everybody really likes to have help on reducing those tuition costs. If you go to our College of Nursing website, and you can see there are a number of endowed scholarships listed. We do not manage or oversee those scholarships. Those are all managed now by our Student Financial Services team. They all have applications that you can apply for. So those applications typically are going to open in August or September. And so I always recommend students reach out to Student Financial Services sometime as it gets closer to the fall quarter starting, and then they will give you the resources to be able to find those applications to those endowed scholarships. I also have a list of common scholarships that a lot of nursing students will apply for, and I'll be sending that out to the cohorts after the advising sessions are done. And then I also encourage students to explore other scholarships on your own. There's lots of different resources for scholarships out there. All right, so what are your next steps? The next steps are to continue to follow the orientation modules throughout the summer. Complete your transfer checklist items and gather your supplies, and I'll show you that checklist here in just a moment. Some of those supplies, as I mentioned, are scrubs. We do have donated scrubs from graduates. So we have our traditional cohort that's graduating in June, and then we have our transfer cohort graduating in August. So we start getting some of those donated scrubs over the summer. A lot of those scrubs will go to our clinical performance lab it's sort of a student supply cupboard, and that's where those scrubs will get donated. You can just call the clinical performance lab and schedule a time to come by to look at donated scrubs and see what they might have available. If you want, you can also email me. Sometimes scrubs get dropped off in the Grand nursing building, just right outside my office. So you can also check with me to see if there happen to be any scrubs available in this building. Definitely watch your email, that's student SU email for your BSN health packet, Castle Branch setup, all that's going to go out in July. But if you're interested in looking at what those health requirements are before you get the health packet, you can just type in health requirements for the College of Nursing in the search bar, or you can go to that link here in the PowerPoint slide. You're also going to be getting an email in July asking you to complete the Voices for Change online student training. And it is a training to promote a healthier and safer campus. This training, it's an online training, and it is required by all incoming students to Seattle University. Please take care of that over the summer, because if you don't, they do put a hold on being able to register for winter quarter classes if you don't have this completed by October. So make sure that when you get that email that you're addressing that and going through that training. It can take about an hour and a half to 2 hours to get through the training, so it allows some time, but that's why I encourage you to do it over the summer so that you don't try to do it while you're also trying to study for your classes this fall. Also, watch for emails from me over your student email over the summer. I'll be doing some check-ins and just sort of checking in and making sure everybody's on track and updating you on your next steps and some upcoming things to be aware of. Refresh your A&P 1 and 2. The number one thing to be ready for fall quarter is to refresh A&P 1 and 2. Just go back, review, just periodically check back through those notes and through the textbooks, because A&P 1 and 2 is the foundation for understanding the pathologies that you're going to cover in pathophysiology. And they're going to assume that you have a good solid foundation in that knowledge, and they're going to hit the ground running, and you have 10 weeks to cover all of that material. So please review A&P 1 and 2 over the summer. And then attend your college induction day, which is going to be week 1 of the quarter. And again, that'll be something that's in your orientation modules you'll get from the orientation team, but I will also be sending you an email reminding you about that date as well. Okay, so that is the presentation. So before I open it up to questions, I am going to stop share and we're going to look at the transfer checklist really quick. Okay. Okay, so hopefully everybody can see that screen there. Okay, so this is the transfer checklist. And again, you don't have to try to remember all of this. I will be sending this out with the PowerPoint slide so that you can refer back to this and review any of the information in this checklist. So number one, if you haven't, go ahead and confirm your enrollment if you intend to start with the program this fall. Activate your SU email. This is the official communication tool from the university. It is also the official way for me to communicate information to you. So for a while, I'll be emailing your personal and SU email account, but I will notify you when that switches and I will no longer be able to email to your personal email. So please make sure you set up your student email account soon. Apply for financial aid if you haven't already. Complete any remaining prerequisite coursework, and then, of course, submit those official transcripts to the Office of Admissions, and then submit your immunization records to the Student Health Services, and then complete that Voices for Change training that you'll get in July and August. Okay, so some of the other ones to complete that are specific to the College of Nursing. There is that BSN health packet that will be emailed out in July, and you'll have instructions with that packet on what to do. Complete that CPR training and certification. Review the BSN handbook on our website just to kind of familiarize yourself with any questions or policies or processes that you might be curious about. You're also going to need to get a student campus card to get access to buildings on campus. And it also, I believe, gives you some discounts with some of the shops around the university campus. You are also going to need a nursing ID badge. This is separate from your student campus card. And it is a badge, not a name tag. So your nursing ID badge, you're going to need it when you go into clinical settings, and you will get this from the same place, super copy, in the pavilion that you get your student campus card. The nursing ID badge is going to use the same photo that you submit for your student ID card, but you will have to specifically reach out to the super copy folks and ask them to create a nursing ID badge for you. There's not a way to access that through the link, which again will be something that I'll email out to the cohort, the link to do all of that online. So you'll want to call them or email them to make sure that you get the nursing ID badge specifically. And then work on getting your textbooks. One thing to note about the health services, student health services, and the health packet immunization requirements. The two systems do not talk. So you have to submit immunization requirements for the university to Student Health Services, but you have a lot more immunization and vaccination requirements for clinicals. And even though a couple of those might be the same, the nursing health packet and Castle Branch do not pull information from each other. So if you're feeling like I've already submitted my immunization stuff when you're doing the BSN health packet, it's because you're having to do it a second time for a separate system. But if you have any questions about that, definitely let me know. Then on page 2 are your supplies. So talking about the scrubs. The scrubs color that we use and require for our clinical settings are the navy blue. You'll have to have a scrub top and scrub bottoms. Those bottoms can be pants or skirts. We are currently right now in the process of changing vendors at the bookstore. So if you go into the bookstore, they may have some samples of scrubs that were available from last year, but they may be looking at using a different vendor for this fall. So if you are not sure what scrubs need to look like, you can stop by our campus store. You can purchase them already embroidered with the College of Nursing logo on them on the top, or you can buy just navy scrubs and then buy an SU College of Nursing patch, and then sew the patch onto the scrub top. The bottoms do not have to have an SU logo, just the top has to have the SU logo. So again, the scrubs can be purchased at the bookstore or you can purchase them elsewhere, but just make sure if you're purchasing them elsewhere that you buy the patch from the bookstore so that you can sew that onto the scrub top, because that identification is required to be in clinical settings. So the SU lab coat, it can be purchased at the bookstore. It is not required, though, for all clinical settings. So we really recommend that students wait and don't purchase the lab coat until you hit a clinical setting that requires it, okay? Professional shoes, so these are going to be closed-toed, really protective, non-perforated leather shoes that are in good condition and have good support. And imagine a pair of shoes you're going to be spending 12 hours walking around in a hospital in a clinical setting in. So make sure that they're comfortable. I know that a lot of students will start sharing information about shoes and different types of shoes, things like that. So you can also Google that. There's a lot of good information on what types of shoes are good for clinical settings. But we want to make sure they're closed-toed, because if you think about clinical settings with sharps, so needles, sharp items, body fluids, spilling on your shoes, you don't want your bare feet to be splattered with that or poked. So we want to make sure those are closed-toed, good shoes that are going to protect your feet. You're going to want a wristwatch that has the ability to count seconds. That can be digital or analog. But again, think about the clinical settings, and there's lots of fluids that happen in clinical settings, and you may not necessarily want to have your nice Apple or Samsung watch in those types of settings. So we always recommend getting just a really inexpensive watch that you wear during the clinical settings. And then a stethoscope. So stethoscopes have to be a dual head bell and diaphragm, and it needs to be adult physical assessment. So you can buy child-specific ones, but we want you to get the adult one. The dual head will allow you to do adult and child with that dual head stethoscope. So the cost for those is usually around $50 to $100. You can find some for less, and you can find some for a lot more, but really kind of this median price point would be what we're looking for to make sure that you can hear good sounds through those. The stethoscope brands are Littmann and MDF, and those are the most common ones that you'll hear about. I definitely encourage you to go online and Google Littmann versus MDF for clinical settings. There's a lot of different information that you're going to get about the different stethoscopes and the price points and some of the things that you might want to know about a stethoscope. So definitely go out and do some research. There's some great YouTube videos. I'm sure there's TikTok videos, Instagram, Snapchat, all kinds of videos and information about how to compare and what type of stethoscope to look for. But just make sure it is the dual head and bell so that you can see it looks like this. It's going to have two sides. Okay, so that was the advising information. I will now open it up to questions. So does anybody have any questions? You can type them in the chat, or you can also feel free to just speak up in the setting. No questions. Okay, can I register for classes even before my advising appointment? No, you can plan your classes, but no new transfer students can register until June 3rd or after. So if you're attending this advising session today, I'll be able to go in and remove that new student hold, and then you'll be good to register on June 3rd or after. Are we able to add courses to a shopping cart before registering? Kind of. That's kind of what the planning tool is for. So you can plan those classes, but it doesn't really put them in a shopping cart, i.e. it doesn't mean that it blocks off that spot in that section for you. The planning tool just lets you sort of plan your schedule, but then when registration opens, you're just going to be able to register for whatever sections are currently open at that time. So not exactly like a specific shopping cart. I hope that answers that question a little bit. Okay. Okay, so there's a direct message. Okay, so what are the vaccination requirements? I have the documents beforehand and the deadline to submit the vaccinations. Okay, so the vaccination requirements, there's a lot of them. So again, I'm going to be sending out to the cohort the PowerPoint slides and the links to access all of that stuff that I talked about in the presentation today. So you can do that. But if you just go into Seattle U's website and type in health requirements, for College of Nursing, it'll be the first link. And when you click on that, it'll list all of the requirements that you need for immunizations. And those will be the same ones that you're going to have when you get the health packet in July. There's a number of them you're going to have to do, and there's a number of steps that you might have to go through for those health requirements. So that's why I don't really list them out here. The deadline for getting all of those will be the deadline for the health packet, which I believe is in October. But I always recommend students get started on it over the summer, because when you start your classes, you're going to be very, very busy with pathophysiology and health assessment and practicing your skills. And it's going to be hard to start working on those immunization requirements as well. Okay, so for those of you that did schedule appointments, because they opened up the new student checklist, but did not have these group sessions for the advising sessions in the checklist yet. They just had schedule an appointment with your advisor. So I know a lot of students went in and scheduled those new student advising meetings to talk about classes. You can cancel that appointment. You don't have to keep that if you attended a session. And yes, the registration date is June 3rd, so you can still register for those classes. Because you've attended the session today, I'm going to be keeping a roster of the folks who attend these advising sessions, so I can remove those new student holds for students that do attend these sessions. So then you should be good to register on June 3rd, and you don't have to keep any of those June 3rd or after individual advising appointments unless there's something specific that you want to talk about. But this sort of takes the place of that individual student meeting for advising. If we drive to class, is there parking for students on campus? Yes, there is parking on campus. If you go to, I believe in the orientation modules, there's something that talks about the parking and the parking pass and the Orca pass. So definitely make sure that you review that information there. There's a lot of great information, and then folks that you will connect with if you have questions about those processes and paying for those parking permits, because that's all handled through our campus security folks. I believe there is a fee for those parking passes, and so you'll want to make sure that you cover that as part of your those costs for the program as well. Can you repeat when donated scrub tops will be available? Yes, so scrub tops, there may be some available currently in the clinical performance lab. There's none in the Garand building outside my office yet, but those will start coming about the middle part of June. And then over the summer, they'll just continue, students come in and drop them off, but they also drop off a lot more of them in the clinical performance lab setting. So I would say reach out to the clinical performance lab probably around June 10th-ish, 12th, and then start seeing what, if they've got any of those scrubs that are there that you can look at and pick up. Also in August, so after August 12th, the transfer cohort will be graduating and they will be donating their scrubs then as well. So there will also be scrubs that will be coming available in August. So if you miss out on those donated scrubs over the summer, just know that there will be more that will be available in August and early September. All right, great questions. Any other questions? Okay, for the CPR certification, is the name of the course CPR BLS for healthcare providers? Yes. Is the deadline in October? Yes, it will be the exact date deadline will be on the health packet that you'll get in July, but it's typically in October. Do we register for the class on the American Heart Association website? Yes, you will register for the class through their website, and then you'll schedule your skills assessment or the skills test with the mannequins on whatever date works for you at a location closest to you, wherever you're at when you take that. Okay. Do we need a specific shoe color for clinical? Great question. No, you do not. And you'll hear students that were like, I just wore my tennis shoes in the clinical settings and for health assessment, and that's fine. The clinical performance lab will also give you some specifics about shoes if they feel like the shoes you're wearing in the health assessment environment in the clinical performance lab are not appropriate. They will give you feedback on that as you start that class as well. Will you email this PowerPoint to our SU email or personal email? I will email it to the personal and SU email because right now there are some folks that are having some trouble accessing their SU email. So to make sure everybody in the cohort gets it now, I will send it out at the end of the registration sessions, which I believe will be June 5th. So after June 5th, I'll email those out to everybody. And so you'll have these to kind of refer back to. But if you have any questions between now and then, definitely reach out and send me an email. Any other questions? Does the CPR certification have to be completed within 1 year? What is the time frame within which I must take it? The CPR certification, it varies based on the different types that you do, the different classes, but I believe once you get the certification, they're good for 1 or 2 years. Does it have to be completed within a year? So it definitely has to be, you have to have it completed and be certified and get the certification card before, by the deadline in the health packet that you're going to get in July. I already have a CPR certification. Do I have to take the class again? Possibly. If your CPR certification is not from the American Heart Association and does not say basic life support on the card, you will need to retake that certification. Even if your certification is good for the next year, you'll need to retake it if it does not meet the American Heart Association, BLS, or basic life support for healthcare providers requirement. The checklist will be sent with the PowerPoint. Yes, the checklist for the transfers, student checklist with scrubs and stethoscopes information will all be sent with the PowerPoint as well. Any other questions? The early information, let's see if you missed the first 20 minutes, probably nothing really specific. Mainly it was probably just information on just kind of getting started with the processes, kind of talking about the advising pieces. But again, when I send the PowerPoints out, see, Aaliyah, I can send the PowerPoint for those specific pieces. I can send a summary of those specific slides to you. And then when I send out the PowerPoint to the whole cohort, after the advising sessions are done, then you'll have the whole piece. But for registration and being able to register, no, you should have been, I think you should have been able to see all of the stuff for registration. So also be able to lift your hold is what I'm saying. For UCORE 3000 level, can students take it in the fall? Yes, the 3000 level classes can be taken in the fall if you want to look at those as options for your schedule. There may be some prerequisites that show up for the 3000 level classes if you don't have all of your transcripts submitted and all of your courses completed. Some of the 3000 level classes require 75 or more credits to be completed, including your transfer credits. And so if you meet that requirement at the time of registration, then you should be able to register. If you're having difficulty registering for a 3000 level class, and that's the one you want to try to register for, and there's space available, definitely that's a situation where you would email me, and then I'll go in and look and see why you might be getting that error or something preventing you from being able to register. If it's something that I can override, then I would be able to override that so that you can get registered for the class. Okay. Okay, So Rachel, I'll have to take a look at that, and then I will let you know outside of this setting. Student has 75 credits or more than a student can register. Yes. Yeah, I can't think of any other prerequisite requirements that you would run into with a 3,000 level class. But if you try to register on June 3rd and you can't, definitely just let me know. Can clogs be worn for clinical shoes? Yes. The main thing is to make sure that they're going to be comfortable, lightweight, stay on your feet, and protect your foot. What should I do if my UCOR is a placeholder? So if you have, there's a new thing that they did for the curriculum templates, and it says UCOR placeholder. I believe there's a link in there that you can click on that will open up and show you the UCOR options you have available. I don't know yet, because the registrar's office, I don't know if it actually lets you add the section to the plan. In which case, that's where you might want to go into the class search and then add that specific UCOR to your schedule and then plan that section so that it's ready for when registration opens. Can you register for any level of UCOR? Yes, you should be able to register for any level of UCOR that shows as needed in your program evaluation. If you're getting any errors, let me know. I know sometimes as they're getting in transcripts and things are not in, that sometimes like the UCOR 1100, which is an English class requirement, the equivalent may not be brought in yet, or they might be waiting on grades or transcripts. And so that might prevent you from being able to register for a UCOR, in which case you would just let me know, and then I will go in and look and see what the issue is. And if it's something that I can override, then I'll be able to override that for you. But yeah, you should be able to register for any level of UCOR. And again, for post-bac students, your UCORs are going to be a little bit different. And I'm working on getting that updated in your student planning tool, that timeline. So watch for that. But if you have questions about those UCORs as a post-bac student or a student who has a bachelor's degree, definitely schedule a one-on-one appointment, and we can kind of talk about that a little bit more, because there are some things to think about as you think about those UCOR classes as a post-bac student. Okay, is wearing closed-toed running shoes okay, or do we have to buy a certain type of shoes for nursing? So for health assessment, closed-toed running shoes might be okay. So I would say you can start out wearing those. Definitely know that the clinical performance lab may tell you that they feel like they're not protective enough. So it kind of depends on the shoe. What they're looking for is something that's got more plastic or vinyl or leather over the top, and not just a soft all fabric shoe. Although I have heard that students have been able to go through health assessment class just wearing running tennis shoes and have been just fine. So I would say you can start out wearing them, and if they tell you that they are not appropriate, then you would have to get specific shoes, and then they have specific requirements that they'll tell you to look for in those shoes. But for the most part, I think most folks can wear running shoes to begin with. Once you get to your clinical sites, the clinical sites might have more specific requirements for those nursing shoes. Can you register for classes and still keep the individual advising appointment for any other questions about registration? Yes, you can absolutely keep those individual appointments if you've already scheduled those. What is the time students can register for class on June 3rd? So on June 3rd, registration is supposed to open around 9 a.m. Now, last year, it didn't open until a little bit after 9 o'clock. So even though I say it opens at 9 a.m., it might be a little bit after that. So if you're trying to register and it's not letting you register and you're not getting any errors, then just keep trying to register. And as soon as the system opens, you'll be able to register. But typically it opens at 9 a.m. So I'm hoping this year it will actually open at 9 a.m. All right, any other questions? All right, so we're almost at time. If you do have any other specific questions or things that come up outside of this session, definitely email me. Or if you have an appointment scheduled for after registration, you can certainly save questions for those appointments as well. And I'll be reaching out to the cohort, like I said, to talk about those individual appointments and things like that over the summer as well. But otherwise, if you don't have any other questions, that's it for this advising session. I look forward to working with you all this fall and getting to see you as you start your classes this fall. Have a great afternoon.
Thank you.
You're welcome.
Thank you.
Thank you.
Thank you.
You're welcome.
Thank you.
Question. I don't.
Sorry?
I have a question. Can I ask you?
Sure. Let me just stop the recording.